Hello folks, thanks for joining me today for my health news update. It means so much to me that you're taking the time to watch my videos. I would like to ask you to subscribe to my channel if you haven't done so already, and to hit the like button, as well as that notification bell to be alerted to my latest content. With that being said, on to the health news stories of the week. I only picked two health news stories this week instead of my usual three that I have done in the past 2 weeks. Now, the first health news story comes from JAMA. The title of this article, which was published on September 13th of 2013, is West Nile virus outpacing awareness, testing, and reporting in the U.S. The article starts out by saying, in late August, researchers from the U.S. Centers for Disease Control and Prevention, otherwise known as CDC, reported that almost every U.S. state experienced cases of West Nile virus disease in 2021. And of the nearly 3,000 cases logged that year, 69% were neuroinvasive. More than 2,000 people were hospitalized and more than 200 died. In the article, it says that none of this is unprecedented, however, and that 3 times as many cases of West Nile had been reported in 2023 so far. Let's see. That means around 9,000 cases have been reported in this year already, and the year's not even done yet. The article states that by 2021, the West Nile virus was the most common cause of mosquito-borne diseases in the continental U.S. It also says that more than half the cases came from just 3 counties in Arizona. Maricopa County had 1,500 known infections, more than 1,000 hospitalizations, and 101 deaths, making Maricopa County the largest ever single outbreak of the West Nile virus of any U.S. county. So what's up with that, Maricopa County? What are your thoughts? Now, the article says that Maricopa County had greater than normal rainfall that year. So the West Nile virus, in case you didn't know, was mainly transmitted to humans by the Culex species of mosquito. Just in case you didn't know. I didn't know that until I read this JAMA article myself. Now, if you would like to read the full, complete article, I'll have the link posted below this video for you. I encourage you to do that. There is always something going on with mosquito-borne diseases, and it seems to me that we need to take this stuff seriously because who knows when it is you or a loved one who is affected. That's just my 2 cents of advice. I would be interested in your thoughts, so please leave them in the comments if you feel like it. All right, folks, let's move on to my next story. I know you may be like me, you may be sick and tired of hearing about the dreaded C word. And no, I don't mean cancer, but COVID. Well, if you don't want to hear about it, now's your chance to leave. Okay? You're still here? Great. Thanks for staying. Now on to the story that comes to us via webmd.com. That was also published on September the 13th. And the title of this article is COVID hospitalizations rise for 8 weeks in a row. The article says that hospitalizations from COVID-19 rose for an 8th straight week for the period ending September the 2nd. The article goes on to say that new hospital admissions ticked up 9% to 18,871 people. This was reported by the CDC in their latest dispatch of virus metrics. According to this article, 97% of people in the U.S. ages 16 and older had protective immunity against COVID-19 by the end of 2022, either from infection or vaccination. This info came from a JAMA article, by the way. JAMA, in case you didn't know, is short for the Journal of the American Medical Association, which I referenced in my first news stories, by the way, concerning the West Nile virus. Now, the author of that article warned that reliance on prior immunity may put people at risk because the protection from a past vaccine or infection decreases over time, which in my opinion is quite normal and should be obvious. It goes on to say that it is unclear what the demand will be for the newly formulated booster shot, which targets a strain of the virus that was dominant in January, which is called XBB.1.5. And it says that the new formula has been shown to boost antibodies against the virus variants currently causing the most infections. So I just want to say this, folks. I'm no doctor, but if you're feeling like you're sick, stay away from others, and of course, see a doctor. Do what is best and what is right for you and for others by staying home. That's just my 2 cents worth of advice. Again, to read the full articles for yourself, just visit the links below this video in the description area. I would love to hear your thoughts. What do you think of these stories? Until next week, goodbye, and y'all have a great weekend.